Welcome to this new episode of the series of online training on HPV gender-neutral vaccination organized by the World Federation of Public Health Association. My name is Marta Lomazzi. I'm the Chief Operating Officer of WFPHA and a great supporter of all the activities that we do on prevention. And today we will discuss with the two incredible speakers from Africa about the importance of gender-neutral HPV vaccination. As I hope you have seen, we have done a series of training on HPV gender-neutral vaccination, focusing on different regions of the world and making them in the local language. As I told you, today is about Africa and English-speaking Africa. And we will listen about the experience from two countries, Liberia and the Gambia, and learn from them if and how they have HPV vaccination, if it is gender neutral or not, and what are the plans for the future. But before giving the floor to the speakers, I would like to give you some ideas on how this training will be today. We really want to have a very interactive session. It's a long webinar, it's 2 hours. The first hour, more or less, will be dedicated to the presentation of our guest speakers. The second hour will be dedicated to each of you. So we will open your microphone and video. So you will be able to share not only your question, but also your experience. We hope that we have connected the expert in HPV vaccination or in immunization in general from different countries of Africa, from then Liberia and the Gambia. And so you are all invited to share your experience, to tell us what is ongoing in your country. And of course, you are all invited to ask any question you may want, live or through the chat. That said, it's my real pleasure to introduce our speakers. The first one will be Dr. Adolphus Strachan-Clarke. He is the program manager for the expanded program on immunization at the Ministry of Health in Liberia. He has a strong academic background, including degrees in chemistry and pharmacy from the University of Liberia, an MPH from Cuttington University, and further training in health system management and leadership. Clarke has extensive experience in immunization management, health policy, and public health, playing a crucial role in the post-Ebola recovery efforts in Liberia. His work focuses on reducing vaccine-preventable disease and strengthening immunization program. The other speakers that will follow Adolfo's presentation is Mbayang John, a public health professional currently working with the expanded program on immunization of the Ministry of Health of the Gambia. She has played a vital role in ensuring the effective rollout of vaccine in the region, contributing significantly to improving public health outcomes. She holds an MSPH in public health and occupational health from the University of the Gambia. Before her role with the AP, she served as a regional operation officer in 2 district regions where she coordinated health initiatives, managed field operation, and engaged communities in health promotion activities. Her expertise and passion for public health extend to her current interest in surveillance and monitoring, as evidenced by her recently completed field epidemiology training program with the Epidemiology and Disease Control Unit of the Minister of Health of the Gambia. That said, we have 2 eminent speakers with us, and it's my real pleasure now to give the floor to Dr. Clarke, our first speaker.
Good afternoon, good morning, good evening to all, depending on your time zone. It's a pleasure being on this platform at this point in time, joining this forum to share Liberia experience with respect to HPV vaccination and how we can pivot towards a more inclusive vaccination strategy that looks at both boys and girls, irrespective of the age bracket. That being said, this is the title of my presentation. We are going to talk HPV from a gender neutral perspective. Are we on course as a country? If not, what are the plans? But by and large, we want to focus on enhancing public health through a more inclusive vaccination strategy. The next slide, please. So, I mean, since we weren't given prescribed presentation template, what I thought given the time limit for this webinar is to focus on four critical pieces that looks at HPV introduction in Liberia, the genesis. We talked about the economic implications of gender-neutral HPV vaccination, challenges in implementing a gender-neutral HPV vaccination, conclusion, and then future direction. The next slide, please. Okay, so before then, I'd just like to run through a few bullets in terms of intro. We all know that HPV in terms of acronym stands for the human papilloma virus. And this is a disease that is transmitted sexually. That's a fact that we know. And we know that then in the course of progression, it can lead to cancer, to include cervical cancer, because there are other HPV-related infections that can also cause anal cancer, it could cause penile cancer. There are different forms that could result into. Thankfully, we have a proven preventive measure, which is the HPV vaccine, that not only prevent cervical cancer, but also helps in the prevention of other HPV-related infection. And then, of course, the importance of gender-neutral vaccination to protect both male and females. Next slide. So the story of HPV started far back in Liberia, as far back as 2016. But just to give a more recent or current stats in terms of what the situation looks like, the WHO 2020 and GlobalCon 2020 report still show that in Liberia, cervical cancer ranked as the #1 cause of cancer mortality in female and as the #1 of all cancer mortalities in Liberia. So this is a disease of concern, and we need to roll up our sleeves and see how we ensure that we can defeat this. So that being said, the story of HPV started like other countries with the demonstration. So Liberia took in the HPV demonstration process in 2016, at which time, based on the restriction, we had to focus on 2 counties, Bunk and Nimat, and we were looking at girls 10 years that were in and out of school based on vaccine availability and other restrictions prescribed within the demonstration guidelines. We were successful in carrying out the demonstration and had hoped to introduce the vaccine in 2018, but we had some delays as a country, and it was routinized on the 25th of November 2019. So HPV vaccine now is part of the routine vaccination program that is administered across the 15 counties in Liberia, and is currently administered to girls 9 years that are in and out of schools in Liberia. We made determination for 9 years, one, because of the stock available, two, the cost implication, and then three, in Liberia, it is tradition that a 9 years old girl child may not be involved into sexual life, and so we decided to start with the age before sexual life, and so a decision was reached to focus on 9 years girls that are in and out of school in Liberia. As of 2023, our administrative coverage for HPV stood at 91% for the first dose and 45% for the second dose. So it tells you that we are still struggling with HPV dose 2. However, based on new information regarding the effectiveness of a single dose HPV as compared to the 2 doses, the country is in the process of having a shift from a 2-dose HPV vaccination schedule to a single dose HPV vaccination schedule. So what our focus would be to sustain whatever gains we've made with the first dose And in those counties that are lagging, how can we build the courage and sustain it as well? And we hope that the switch process will actually take place in 2025, January. Next slide, please. Okay, so what are some of the economic implications that we think we need to consider when talking about a gender-neutral HPV vaccination? For instance, we want to look at the healthcare cost, the cost around treatment, especially in a low-income country. We know that the cost in a low-income country becomes almost unbearable for the patient and even for the families. So we think that having HPV vaccine being administered not only to girls, but to boys also help a parent and a caregiver and by extension the health system in terms of cost savings and redirecting or reallocating sales savings to other critical health system areas that will need urgent budgetary support. So that's one economic benefit that we see there. We also see that it leads to increased productivity because in the final analysis, we're going to have a healthy youthful population that will contribute substantially to the overall economic growth of the country. So take, for instance, in Liberia, persons between the ages of 0 to 17 years account for 40.1% of the total population. And those that are between 18 to 34 years account for 33.5%. So it tells you about 73 or more percent of our population, they appear to be youthful. So having a very youthful population and focusing on ensuring that they are protected brings economic dividend to the economy and to the country by extension. So we think that that's another benefit that we need to look at if they are healthy and they are protected. And so those who are into the discipline of health will also contribute to the health system by extension because they will be healthy, they will be able to go to work, and they will be able to protect as many persons or clients that they have to treat within the course of their duties. And then, of course, the issue of equity. We see a gender-neutral vaccine promote health equity by ensuring that both boys and girls are protected because from the get-go, we struggle with this question from caregivers. Why are we only vaccinating girls and not boys of same age? So that also served at some point in time as a breeding ground for mis and disinformation. People felt that the HPV vaccine, when we started, the demonstration was intended to make the girl child get pregnant. It was intended to do something evil to them. So there was a lot of myth around this, but thankfully none that there is this quest to ensure that countries rethink their HPV vaccination strategy to be more inclusive, to consider their male counterpart or boys in this case. We know that in UK, for instance, in Canada, in the US, boys are receiving HPV vaccine as well. So how can we ensure that HPV-related infection can also be prevented in male counterparts? So these are some of the things that we try to consider as we move along. The next slide, please. So of course, the cost effectiveness, it is efficient use of resources can attract international funding and support. So for instance, if we are able to vaccinate both male and female within our vaccination program for HPV and able to demonstrate cost efficiency, we thereby reducing wastage or damaging of vaccine or expiry because of the difference of the dropper we have between those one and those two. As you saw, 91 and 45 is substantial, approximately 46 percentage point difference. So what that means is that if those people who did not receive their dose two don't show up and you have a very short shelf life vaccine, the tendency for it to get expired is very high without it being fully utilized. So in that instant case, we will be inefficiently utilizing resources with respect to the vaccine itself and other supplies. So we think that if we are able to demonstrate efficiency around available resources, it helps to attract international support and then also bring in additional resources that can help to enhance the health system, by extension, the economy. And this can also lead to long-term health outcomes that includes reduction in cervical cancer rates within country. Can also lead to economic stability because you wouldn't have people being sick. You have a more healthier population that can contribute towards the growth of the economy in a more productive way, as opposed to having more sick people. And there is so much being done to get them back up to their feet. The next slide. So what are some of the challenges that we envisage? We recognize the issue of cultural and social norms. I mean, we are in a traditional country, and so we must recognize that the settings will differ from county to county, from country to country, and from district to district, from communities to communities. So we recognize that, and it's something that we have to work on going forward if we have to bring on board male counterparts to receive HPV, because then the question comes back at us, why you started to vaccinate only females and now you're adding the male counterparts. So we need to recognize all of these things. We also need to take into account community resistance, because from the get-go, we told them that we're only vaccinating males. Suddenly now we're talking about bringing males when we're only vaccinating females. So what has changed? How can we use available information to reinforce the importance of the vaccine and why they need to trust the system to have their male child 9 years or 9 to 13 years being vaccinated with HPV. So these are all challenges that we anticipate and look forward to working with our communication folks or folks in social behavior change to see how messages can be crafted more positively to address these anticipated challenges. Of course, the issue of resource constraint, bringing on board the male counterpart brings on board additional doses. And the fact that HPV vaccine is one of those co-funded vaccines through Gavi, what that means is that the country's counterpart funding mechanism will also increase. And so it's something that has to be further discussed with the Ministry of Finance to be able to mobilize the additional resources to support its co-financing contribution. Yes, certainly there will be concern around infrastructure, coaching equipment, vaccine carrier, food boxes, refrigerators. So these are all things that we have to consider and see how we can invest in them if we have to consider bringing on board the male counterparts. And then, of course, our supply chain system, you have broken or aged coaching equipment, they have to be replaced. Some of those ones that are repairable have to be repaired. Vehicles that are broken have to either be repaired and or replaced. And then, of course, ensure that there is availability of vaccine at all point in time to avert stock out of the vaccine, because it will also serve as demotivation. If people are mobilized to show up to a health facility and having worked 2 hours or an hour, 30 minutes, only to know that the vaccine is not available, it serves as demotivation. So these are all challenges in terms of operation that we need to recognize and see how we can develop practical strategies to address those before we have to switch. The next slide, please. And now, of course, there is concern around policy and governance. We need to ensure now that our immunization policy is revised to support that, because the current policy that was updated 2022 still reflects the administration of HPV vaccine to girls 9 years. And so bringing on board male counterpart means that that policy has to be relooked at. So it's a challenge that we see. So there has to be a clear policy framework that supports the gender neutral vaccination prior to its implementation, because that would be our reliance. A parent could just ask you, what is it within your policy that supports you vaccinating my 9 years old boy child? So it also has to be supported by that. There has to be awareness. Of course, I've talked about that. The communities will have to be engaged. awareness campaign has to go on within communities, within schools, to ensure that the shift is more positive so that we don't have any resistance or non-compliance or hesitancy. So the awareness and education campaign has to be very strong. The other thing we recognize is that the vaccine was introduced November 25th, 2019, and we know the story about March 16, 2020, Liberia reported COVID. The first case of COVID on March 16, 2020, there were closure of schools. So that led us to missing out on good number of girls within the gray age bracket, and these girls have not been captured yet. We are hoping to do a HPV vaccine next year, at which time we'll be vaccinating girls 9 to 14 years. So we hope that those girls who were missed out on can also be considered. With the issue now of gender-neutral vaccination, we are going to further discuss to see whether the HPV vaccination campaign can also bring on board male counterparts and what that implication would be in terms of vaccine availability and operational cost. So it's something that we'll discuss with Gavi and see the possibility along with other partners, how doable or feasible that is. And then, of course, the issue of equity and access. We know that there are communities that are beyond 5 kilometers. We know that there are communities that are beyond 10 kilometers. How do we ensure that, irrespective of their geographical positioning, they have access to life-saving HPV vaccine, both the male counterpart and the female counterpart? So this is something that we have to ensure that happens. But again, we recognize this as a challenge because some of the areas in terms of access are very, very challenging. Some of them, the roads are horrible. Cars can go. If you walk in footpath, you have to walk 3, 4, 5 hours. But with commitment, we think that these challenges can be overcome. So it's something that we want to strategize as a country, not using a one-size-fits-all approach, but focusing on counter-specific approach. What works in counter A would be the approach we think that should be developed to address whatever challenge or challenges we've identified. So these are some of the things we want to do, but we want to brace ourselves to the reality that there will be challenges or there are challenges. And if we are able to recognize those challenges, then the possibility of solution is imminent rather than thinking that it's just going to be a free ride for us to transition. The next slide, please. So in conclusion, we think that we need to enhance our public health and reduce the burden of HPV by vaccinating both male and female. That's one thing we are sure of. If we are able to vaccinate both male and female, the tendency of reduction in terms of HPV burden will be very high, because we know that there are other HPV-related infections in males, like I talked about penile cancer, talked about anal cancer, oral pharyngeal cancer. There are different other forms that the male counterpart could be confronted with. And so if the cause of the infection is HPV, vaccinating that male child also helps in reducing the burden of that disease. The other thing is that there will be greater herd immunity at teen, because the more we are able to protect, the greater the herd immunity. And so once we are able to reach more targeted beneficiaries within the community, the more resistant the community will be to an infection because of herd immunity. And so even if there is an outbreak or case, that community wouldn't panic because of the herd immunity profile or rate. And we think that this will help to reduce transmission and, of course, promote equity from a gender perspective within the healthcare system. The next slide. So what are our future directions? So I'm just going to take the broad bullet. So one, like I said, we need to strengthen the policy framework. So before the switch, there has to be a clear policy framework. So our immunization policy, we have to speak to our actions that we want to implement. So there has to be a review or revision of the existing policy to reflect whatever policy shift or change that we want within the immunization program. We have to ensure that that framework is aligned both with international guidelines and best practices, so that we are not doing something totally different from what the globe is doing. So that platform has to be there. And we need to ensure that within our national schedule, vaccination schedule, there is that shift. So the first thing that has to happen, we have to strengthen the policy framework. The second thing, we have to secure funding in terms of sustainability. So we need to advocate with the national government for additional budgetary support, because bringing on board the male counterpart indicates that we are bringing on board additional financial burden to the government. And we all know that the government has got multiple priorities. So the sooner we are able to engage them to be able to commit their resources, the better for us. But also the government also need to interact with our donor partners to see how they too can complement government support within that respect. The other thing, from a sustainable mechanism perspective, we need to ensure that there is a dedicated trust fund for immunization in the future that helps to address some of these operational challenges or issues around vaccination program. Next slide. Of course, we think that monitoring, evaluation, accountability, and learning plays a very critical role. We know that then after the introduction of a new vaccine, we do a post-introduction evaluation. Now, we think that what is also important is that as we bring on board a different age bracket, there has to be an evaluation that or a research that informs policy decision going forward. How did the community respond to the inclusion of male counterpart for HPV vaccine? What lessons can we learn from that to inform other future situation within the vaccination program? So that's something we think is also very critical. So male plays a very critical component of our future direction with respect to not just the inclusion of male counterpart for HPV vaccine, but the vaccination program in general. And of course, the last component has to do with community engagement education. We think this is a very critical piece. In the absence of having a robust awareness campaign on the importance of gender-neutral vaccination or the inclusion of male counterpart for HPV, the tendency of hesitancy, the tendency for misinformation, the tendency for disinformation becomes very high, and that could lead to low uptake of the vaccine after substantial investment. So we think that these four components are critical if we have to succeed in terms of our future directions. Next slide. Yes, so thank you in the different vernaculars. Thank you.
Thank you very much, Dr. Clark, for this enlightening presentation. Very, very useful. And what I like most was this kind of organizing the presentation into main part was in the economic impact of vaccinating or not vaccinating. And also the second part about the gender gap and the equity gap, both part of the same problem and both part of the solution. Of course, we will have time for in-depth discussion with the Q&A at the end of the second speech, but I would like to highlight 2 points that for me were very, very important from your presentation. Concerning the economic return on investment, you said very properly the efficient use of resources can attract international funding and support further enhancing economic stability. And if I may add, also the health system stability. So this is a very wise observation because we are going beyond the single vaccination of HPV, but how to strengthen health system and the stability of the country, the economic stability, through a wise utilization of the resources, and going for gender neutral vaccination is a clear example. The second point was about the gap, the equity gap that you very clearly stated is not only a gender gap, but is a socio-economic gap. And we need really to tackle both to make sure to protect our communities and the federation and the generation to come. So thank you very much for highlighting these aspects. That said, it's my pleasure now to give the floor to our next speaker that will speak about the situation in the Gambia. So, Bayang Jom, the floor is yours.
I am Bayang Jom, the Minister of Health, the Gambia, in the expanded program on immunization unit. This is the country's demography. The Gambia is located in West Africa. It has a population of 2,422,712 and a population growth rate of 2.5. We had 7 health regions across the country and the HPV target of 38,084 yearly. And the delivery strategies we're using is the school-based outreaches and fixed strategies to give in the HPV vaccination across the country. This is just an introduction about HPV, and it has about 200 well-known types that really causes cancers, and it's related cancer known also in the world. And normally, the infection itself doesn't cause much havoc, except among 5% of individuals who get infected of the virus. And some of the high-risk HPV types that causes genital warts and cervical cancer. And it's also associated with cancers of the vulva, the mouth of truth, penile, anal, head and neck, and so the list goes. And the prevalence of the virus is higher among women and also men that have sex with men, like the gay and people whose immunity are compromised. The global situation, I brought this just to show the HPV virus is not only a disease of only women, but it is a disease or is so cancerous that it affects all gender, both men and female. And it had been also the 4th leading cause of cervical cancer deaths in women. That was in 2022 by WHO. And you can see the rate is higher in the sub-Saharan Africa with 24% of prevalence of cervical cancer rates. And now to the Gambian context, and I have more about HPV in the Gambia. So far, what are the things that we've been doing towards the HPV vaccination? And to assess screening and diagnosis is low in the Gambia, limited and usually too late. About 80% of patients come to be are diagnosed very late, obviously when actually no good could be done on them, or there is no medical help that you can do without really losing them. So awareness level in the Gambia about HPV is honestly very low. And among those who were screened against cervical cancer, the prevalence of the HPV infection is about 12%, and out of which 32% would get the infection or the disease. And this was a study that was done here in the country in 2018. And the burden is more likely higher than known due to low rates of screening and diagnosis. So the awareness level still of people in the country towards the HPV, it's really very low. Next slide, please. Still, the burden continues, and this is a recent studies that was done this year, which shows 338 women were sampled, out of which 326 were diagnosed with cancer. And you can see how high the rate is. About 96% were all having cervical cancer. And this was just a study done. They may have not really even realized they were with the disease. And when it comes to screening them for the HPV DNA, out of whose sample were adequate, 119 were adequate. And out of that, 104 really tested positive. And we know using the HPV DNA screening, which is highly sensitive, really shows out that they really were affected. And mostly the serotypes, the types of HPV that were isolated was the 16 and 18, which are the most high risks of causing cervical cancer across the world. This is these data I will present here based on the demo. Of course, HPV started as a demo, and it was only piloted in one of the regions in December 2014 across May 2016. And the first year during the demo, first dose was given in December 2014, and the second dose was given in June 2015. So it's the interval of 6 months from dose 1. And so as the second year of the demo, the first dose was given in 2015 November, followed by the second dose in 2016 May. So these are the results that were gotten from the demo that really had encouraged the country to rule out in 2019. So these were the results for year 1 and 2, 92% and 82% and 91% respectively. So results were so promising and really had made the country to scale up in 2019. These are results of periodic intensification of routine immunization, a strategy that we use in the country to increase or optimize vaccine uptake. So this was done in September 2023, and the legend here, blue, represents first doses, and the red bar are representing second doses. And this was done across the country, and the figures have shown. And when it comes to the WR2, which is the Western Health Region 2, less significant, especially when it comes to the second doses we're given. And this region obviously is the second most largest part of the country. And the figures there really would have impact on national data. So data for HPV still is very low in the country as I am speaking. Next slide, please. This is also another results of the periodic intensification of routine immunization that was done, that was concluded August this year. And URR obviously is doing most higher based on the target population that they had. And up till now, you can see the two Western Health Region 1 and Western Health Region 2 really having the lowest. And these two regions constitute about 60% of the Gambian population. And despite the fact that other regions have done well, if the two biggest regions have not done well, it also really boils down to giving us very low rates, especially national. And these rates or percentages that we had for HPV from January this year to August. And so it reads based on regions equally and a national target of 12.34%. So this also really would help farm the reason why I said the HPV vaccines coverage is really very low. And also when it comes to vaccine awareness for cervical cancer is equally very low among the general public. Coming to the gender neutral HPV vaccination, which obviously is the main topic of the day, and we would talk it. And it's all about protecting every gender and also giving equal access to everyone to the HPV vaccines. In the Gambia, boys and girls have equal opportunity to be vaccinated against all vaccine preventable disease. And of course, the HPV is not exempted. And however, the HPV vaccination targets only the most vulnerable. And here, what I meant by the most vulnerable group is the women, because more so, yeah, both genders have been affected by the HPV virus, the human papilloma virus, but then women are more vulnerable, and we are targeting girls in the country in giving the HPV vaccines. And these are school-going girls and also their peers outside school, age 9 to 14. And the ministry, of course, is also advocating for budget allocation to cater for boys. We know too well that obviously all genders are supposed to be vaccinated, but then due to resource constraint, we only could for now vaccinate only ladies or adolescents. And also adopting gender-neutral HPV vaccine helps reduce the infection rate. And obviously, yes, if the greater chunk of the population are being vaccinated, but boys and girls against HPV, the transmission rate will really reduce or cut down to very close to not even causing any infection among the population, because then it will help create a very hard immunity. The gender-neutral vaccinations also would help in combat misinformation, because as of now, one of the challenges we had is, why are we only vaccinating ladies? Why not boys? So if both boys and girls are being vaccinated, the gender misinformation about the vaccine could really reduce. And also when we started as during the demo, we were doing co-delivery strategy. Boys were not given the vaccine, but they were given deworming tablets, which was the mebendazole was being used. But due to resource constraint, I guess that only happened during the demo. And for all the while that we're doing HPV vaccination in schools and also in the communities, we really could not deworm boys. Next slide, please. So some of the success stories as a country when it comes to HPV so far, we roll out HPV and also integrate it into the routine service across the country in 2019. Also conducted a multi-age cohort that every child that was supposed to be vaccinated, because from the demo, there were like some years that we didn't do the vaccination, but all those were catered for in 2019. So a series of classes were vaccinated during the multi-age cohort vaccination in 2019. Of recent, a cancer control program too had been established to really take care of all cancers, most of the cervical cancer in the Gambia. Periodic intensification of routine immunization, also, like I said, are strategies that we're using to get to good number of girls that were not vaccinated, both in school and also outreaches. And some time ago, early this year, the development of the cervical cancer control strategy plan was also done, where vaccinating boys were catered for, and probably with time, the policies will be changed, and everybody that really should have the vaccine would be eligible to be vaccinated. And development of the cervical cancer vaccination guideline too was done this year. That was about mid this year. And factoring boys to having the HPV vaccines were also talked about. The next slide, please. What are some of the challenges we face as a country in vaccinating girls with the HPV vaccine? Inadequate community engagement is one of the challenges that we're facing so far. And some communities that are also hesitant to the vaccine, like I said, why are we only vaccinating women and not also boys alone? And less awareness of parents, teachers, and even the target, which are the adolescents, have less awareness of the vaccine. Equally, generally, the public in the Gambia are really not aware of what the cervical cancer or the HPV does. Based on the previous slides, you can see how high the prevalence of cervical cancer is among women. and most of them don't really know what the cervical cancer is, and neither do they know what are the causative agents. And a high rate of refusals among madrasas. Madrasas, these are Islamic institutes, and also some of the informal institutes, they're also Islamic, but they are not formal, is also very high. So normally they refuse as institutes to be vaccinating, wherein girls too are enrolled. What do we do in addressing those challenges that we face so far with the HPV vaccination as a country? We said that the immunization section really is doing very well to intensify community engagement, because with community engagement, a lot could be done. You'll be able to talk to the community structures and also be able to have the session like a face-to-face session with them where all doubts could be cleared, and they really would know what HPV is, how is the mode of transmission, what are some of the complications about HPV, and how to really prevent it. The MOH to support, with support from partners, some time back had engaged in mapping hesitant communities. And this was done to really know what are the number of communities that were hesitant to the vaccination. Generally, we are doing, obviously, including the HPV vaccinations, to see how best we can use other stakeholders to also raise awareness in those hesitant communities. The regional health directorates, here the health tier is divided into 3 levels. We have the health facility, the regional health directorates, and also the national level. With Teachers Association, because like I said, the HPV strategy of delivery is the school base in the country. So it is important to also have teachers being aware of the HPV and other subgroups that are within the schools. At some point, too, the EPI reactivated the technical working group that consists of significant stakeholders, which is the Ministry of Basic and Secondary Education, the regional health promotion officers, and also the CSOs, the civil society organizations, because when you look at them, they had their own groups, they had their own organization, they're well trusted in communities, so they can help strengthen awareness level across those communities of their operation. We also have in the regional health promotion and education officers with the immunization officers to orient and engage religious leaders and also other influential leaders in their own catchment area, their jurisdiction of work, wherein they also would be able to know what are some of the cultures, what are some of the beliefs, and how to get into those communities to be able to really talk to them to really take the vaccine or help in disseminating the information for those eligible targets to be vaccinated. Okay, and thank you. That was all from the Gambia for now.
Thank you very much. Very interesting presentation, and very nice to see the journey that the country has done towards the vaccination on HPV, although with all the problem, the gaps that still need to be filled. And I just want to focus on one main point I was touching base just before, is data that you highlighted several times. As we all know, most of sexually active people will be infected by HPV in a period of their life. So it's a real problem that touches every and each of us, but we don't see the consequences immediately. And this is a real problem because it's very difficult to create awareness, as you clearly said. And in the context that you presented with the very low monitoring, low screening, low diagnosis, this is even more important. And I believe it will be very, very important that every country has funds to invest in data collection. And I would like to cite the Chief Medical Officer of Australia that said once, in God we trust, everyone else should bring data. And this should be the mantra of all of us as public health professionals, because we need to have a solid basis then to make advocacy with our minister to make sure that the choices that are done, the policies that are developed are done based on science, on strong data, so to make sure to get the best for our communities. That said, I would like to open now the floor to all our participants that, as I said at the beginning, are invited both to ask questions, but also to share your story, to share your experience, to bring in perspective from different countries. So please raise your hand and we will open your microphone and video, and you will be able to interact in a more lively way with our speakers. So while participants get organized for this part, I will start asking a couple of questions to our speakers, and I invite also Adolphus to open the video, please. I have a question for both of you, but starting maybe with Mbayang, because she really touched this point, speaking about the need to create awareness with parents, with teachers, with religious leaders. And as you know, in our organization, we call upon all public health professionals to contribute in the best possible way to prevent disease, to promote health and well-being. But often we have this question, who are the public health professional? Because it's not so easy to define, like in medical doctors, nurses, etc. We don't have a unifying degree that define who is or who is not a public health professional. And what we like to say is that everyone that has an impact on the public health of the people is and should perceive himself or herself as a public health professional. And we may not do the best use of the workforce, the less trained workforce in public health that we have, that are parents, mainly mothers that often take care of the health of their family, our mothers that bring kids to the vaccination center very often, teachers that have an enormous impact on the knowledge of the kids, and leaders in general, but very often religious leaders that could be supportive or very negative about health approaches. And they should be responsible for the message they share with their community. So my question to both of you is, what do you think about that? How can we engage more these health professionals beyond the trained workforce? And how much do you think those people could influence our community? Mbayang, you want to start, since you cited this point somehow in your presentation?
Yeah, I can start, and if I could hear you well, is how to involve healthcare workers. Sir, come again?
I said how we can involve more mothers, teachers, and leaders, like a religious leader, to make sure they support us in preventing disease, in this case, specifically HPV vaccination, but can be applied to every aspect of public health.
Thank you for the question. And I believe having more teachers, religious leaders, mothers, caregivers, having more taking the HPV vaccine is as much as trying to create awareness. Awareness here is really the way out for people to know what the human papilloma virus can really cause, what are some of the complications, and what is the mode of transmission, and how can we really control it. So across those groups we've mentioned, is as much important to really sensitize them, educate them as much as possible to be able and willing to take health into their own hands and also seek for treatment and controlling HPV and its related cancers across the world.
Thank you very much. Adolphus, what is your opinion?
Yeah, thank you. So the first thing I would want to say is that let us go back. Why public health? Now, we do public health because we want to protect and improve the lives of the people and the community. If that is the true intent, then we should all understand that disease prevention requires multi-sectoral efforts. We cannot do it as public health practitioners alone. We cannot do it as health workers alone. I gave you a story of Liberia in the context of Ebola. When Ebola struck Liberia March 2014, we all thought that health workers, health professionals, we had all of the best strategies, the best approaches to beating Ebola. We struggled. People who shouldn't have died until we realized that the community played a very critical component in controlling the disease. When the communities took matters into their own hands in terms of disease prevention, Liberia was able to overturn the situation of Ebola and has success stories to share. That led us as a country to establishing a robust community health assistance program. So if we just speak from that context, there has to be a multi-sectoral approach. We need to involve the journalists, for instance. They need to communicate the importance of the vaccine based on the technical information we gave them, because they are the communicators. We need to equip the community leaders, because they are the ones that their community entrust with the position to lead them. So when we view disease prevention from a multi-sectoral approach, it makes it easier, in my opinion, to bring on board all of the relevant actors. And that is the perspective I think we should view it from. Once we talk disease prevention, we should see it from a multi-sectoral angle rather than just seeing it from a health worker perspective or a public health perspective, because the community is critical. The religious leader is critical. The traditional leader is critical. The community chairwoman is critical. The market woman is critical. The Yana Boards Association, they are all critical. So if we bring that perspective of a multi-sectoral approach, it makes it very easy and it helps in the prevention of a particular disease. Over.
Thank you very much. And I keep two words from what you say that are really pillars of public health intervention: multi-sectorial approach and trust. We need to have both, and to have both every time, to act rapidly, whatever happens, like Ebola, like COVID, but then also to make sure that all preventive intervention like HPV vaccination are in place as soon as possible, thanks to the support of all these leaders that you cited. I've seen there is one comment in the Q&A from Dr. Frances Xavier Bosch-José that I will read, and meanwhile I invite Maria to open his microphone and video so we can continue the discussion. He said the experience of the Gambia hepatitis intervention study is a great example on the value of vaccine to prevent viral-related cancer. The Gambia has a unique experience in an African country, and I would be very pleased really to know more about that and to share this experience with our audience. Over to you, Professor Dr. José.
Can you hear me?
Yes, very well.
Oh, fantastic. I was part of the team that organized the Gambia hepatitis intervention study like 30 years ago. It was a randomized trial that included 120,000 newborns, trying to prove that long-term protection against liver cancer could be achieved by vaccination infants. And all the preliminary results are very satisfactory, showing that indeed there was a strong protection against the hepatitis B persistent infection and eventually liver cancer, which should be published in the coming years. Not very far away, because it's been a trial that has lasted for 40 plus years now. And after that, I worked intensively in the HPV field. And one of the activities that might be of interest for you is the library that we put together in the HPV World website. This is a free access and reader-friendly prepared educational resource that tries to convey the message coming from the HPV research to the essentially the non-professional HPV healthcare provider. The thing is that typically cervical cancer and other anogenital cancers are dealt with individuals who are marginal to HPV. They do that, but they do many other health activities. So they are not specialists. And they have really a difficulty in coping up with the amount of information that is arriving from the research field. So HPV World is a translator, if you want to call it this way, putting together the essence of the consolidated evidence from scientific research and writing it in a format that is, on the one hand, electronically distributed, so anyone can receive it in their phones or in their computers. And in the second hand, it is written in a compact conclusion type of messaging. So the contributions, they typically stay within 500 words, 2 or 3 tables or graphs, and a conclusion that is immediately applicable to the health practice. I will invite you to visit the library. It is an open access and shouldn't be too difficult for you to look at it. And I was now writing to Marta. I think it's you, right? You are Marta, right? So I was just writing to you to invite to publish the conclusions of the meeting that you are organizing initially, and then create a network of dissemination throughout African countries. For the time being, the materials are all in English, but we are now completing a first series of translations and podcast translations into French for the African countries that are French-speaking. So I very much appreciate the effort that you are doing, and consider that HPV World is one more resource that is at your reach, and you can contact me directly for any proposal or any specific activity that we can do in the coming weeks.
Thank you very much for your comments and for your very kind proposal. What you said is absolutely true, and I would like afterwards also our speakers to comment on that. The reality we experience for HPV, but not only for health in general, is that health workers, doctors, nurses, community public health leaders have the problem to cope with too many information and cannot be specialized in everything. And they don't have the time also to go through the latest research to keep themselves informed. So we need to be more creative and provide something that is easy to use, that is fast to use, and they can take as a part of their daily work, but is easy to do and not too much time consuming. So to make sure that at least a basic level of knowledge around HPV, but it applies to all other disease, is maintained. And on top of that, I agree with what you say about the languages, to be very specific and is an information that I want to give to everyone attending this meeting. We are doing a series of events like the one today, focusing on specific region of the world. Today is English-speaking Africa, but we have done on French-speaking Africa in French, on Central and South America in Spanish. We will do in Arabic for the Arab world, etc. So these cultural sensitive and language specific approach is extremely important. And if you are interested in the previous or in the next events, you can find them all recorded, available on our YouTube channel and also on our Facebook page. And more than happy to see with each and every of you how we can share those material that is really done to be used, to be shared, to be promoted, to facilitate capacity building among professionals everywhere in the world. But this is my personal opinion, and I wanted to know from Clark and Bayang what they think about education. What can fit best within the reality of your country to make sure that health providers, but also, and this we are speaking about two different levels, the community level, are equipped with the minimum level of knowledge that will allow them to be effective in the HPV management.
Okay.
Yeah, I don't know whether I can start, but here is it. I will agree with Professor Frank Seck. So there has to be continuous learning. There has to be continuous learning. If you want to be current, if you want to be real time with what is happening in the field of public health, medicine, and whatever discipline you find yourself, so there has to be continuous learning. With that in mind, there has to be a platform that affords shared opportunity in a succinct manner. Because the reality is, in terms of day-to-day operations, the health providers or the public health practitioner wouldn't have the time to read or go through a very bulky document. He or she needs something that serves as a quick reference, should in case there is need for clarification or further guidance. So that kind of mechanism has to be established. The fact that now we are living in a digital world, we also need to ensure that there is an offline, online version that allows a health provider, a community dweller who have access to mobile phone and GSM connectivity to log onto an open source platform and just check for himself and say, look, HPV vaccine for boys, and is able to see the benefits, the safety profile of the vaccine, and make an informed decision even before being engaged by a health service provider or a healthcare provider. So I think this is something that has to happen, but it has to be succinct so as to not discourage the users, because once it is bulky, no one's going to open it. I mean, it will have all of the good resources, but the fact that it's bulky, no one has got that time to go through bulky material. So I totally concur that this is something doable, but has to be readable and user-friendly. So the preciseness has to be very.
So I think that we are very much in the same way. And what I would invite you is to go to that library and examine the topics that you find it attractive and the format in which they are presented, because they are written down in a very succinct and concrete type of conclusion. It is endorsed by all the major HPV institutions in the world, so the scientific quality is reinsured. And if we can manage to get vernacular translations, we are starting now with French and Spanish, but eventually, in collaboration with you, we could create new contributions specific for the African region that you want to cover. And you can see the format, you can see if that is sufficiently concise to be able to read it or hear it while you are going to your office or riding an elevator. You can see at least the headings that we are discussing there. And then if you are interested in that particular contribution, you will have a selection of references. So the healthcare provider now, it doesn't need 3,000 references in the Lancet to understand HPV vaccines. They probably need 5 at the most to specifically address the key results in the trials that have been conducted. And this is our obsession, and we've been doing that for over 20 years now. So we are publishing 4 contributions a month, so essentially it's once a week. You should receive in your phone, if you subscribe, the heading and download the contribution, and eventually resend it very easily to your contacts or your agendas. So if you find the system useful, please let me know, and we can work in more detail how to proceed.
Thank you very much for the kind proposal. We will for sure discuss it and come back to you. Brian, do you have any comment about education and way to equip professional?
Yes, I do. And I would just say thanks to Dr. Juice and looking forward to the trial that they've done here, like the paper. And in addition to what Dr. Clark have said, yeah, it's important we're informed by reading a lot of books on HPV or any other thing, because health is so dynamic that every day new things are coming up. Every other day new things are coming up. And in wherein probably the ministries are not able to like having capacity building on the job, but individually, we can really make efforts to come out, like to be on top of issues, especially when it comes to the human papillomavirus and its related cancers. And here, in addition to that, not just by knowing it yourself individually, it's important we also give feedbacks, especially to the communities we are serving. Here in the Gambia, most of the people can't read or write. Some percentage of people can't read or write. So it is important for us to tell communities that we are there for them. And why we have been posted into their communities, they really should see the impact. So it is important we go down there in the communities, in villages, in every settlement where people are, to really inform them of health issues. So mostly when it comes to the HPV, because here it's obviously a problem. And like I said during the presentation, not too many people, especially women being the most vulnerable, really knows about it. And by the time they report to our health facilities, it's already too late and not much things could be done for them. But if they were informed at hand, they really could seek treatment early, and so many things, probably so many deaths could have been averted or infections.
Absolutely. And thank you very much for providing real scenarios of the reality you have to face. So to give also ideas to other countries on how to overcome this type of barriers. And I invite again participants to really share their stories. This is what we really need to do today to sustain the dialogue and to find the best solution to improve HPV gender-neutral vaccination in our communities. That said, I would like to touch on another point that is extremely important, but that has not been highlighted so much today. We discussed about gender-neutral vaccination to protect boys and girls, but the reality is that what has been done up to now is to vaccinate in many countries only one gender, and this is the only vaccine that has experienced this type of approach. And this has created a big problem about stigmatizing HPV-related cancer and mainly cervical cancer as a woman disease. And this has been a barrier in many cases to women to access screening and treatment, and also to be able to speak about the disease within the family, in the community, with a health professional. And I would like to know from our speaker about their experience in managing the stigmatization of HPV-induced cancer in their country, if it happened or not, and how you see we can work to revert this trend, to avoid stigmatizing HPV-related cancer as a disease for women and by women. Adolfo, so you want to start?
Yeah, so
May I ask to open the camera if internet yes
no,
allows? Thank you.
yeah, so you are talking about stigmatization, right?
Yes,
Yes.
stigmatization of the disease and how to reverse the trend of stigmatization of HPV as a woman disease only.
So, to the best of my knowledge, in terms of country context, we do not have stigma associated with HPV. What we have stigma associated with still has to do with HIV, tuberculosis. These are known diseases that we have stigma associated with. Now, is it possible that a woman with HPV may be stigmatized? I would say yes, but because the public hasn't gotten that level of enlightenment with respect to the disease, probably is one of the reasons why they may not be talking about it in a negative manner. So I think what is critical is to enlighten the public more, to have more health education at the community level, at the level of schools, at the level of the health facilities, doing health talks, to ensure that people are well informed about the disease and and what it does to a woman and how it is prevented or how it can be prevented. So I think in Liberia at this point in time, it's not a disease that is associated with stigmatization. However, I can rule out that possibility, but because the level of enlightenment about the disease is still low, so that is the reason why it could be one reason why people may not be talking about it as only a woman sickness or something else. So I think we need to do more about educating the general public through the different fora or media to ensure that there is this awareness about the disease and its prevention and the benefits associated with the current vaccine that is being used for prevention. That way it makes it easy. And talking cancer in general. I mean, we know now that if you look at global stats, about 74% of global deaths is associated with non-communicable diseases, but which cancer happens to be one of those. So I think the more we begin to talk cancer prevention, the more we begin to talk NCDs, it also helps. I think we should start that conversation across the African continent and by extension the globe, because the last data I looked at in terms of NCDs, I realized that 74% of global deaths, they are associated with NCDs. So it's becoming a disease of concern. And so the more we talk about them, the better for us in terms of prevention. Over.
Absolutely, very important point you made at the end. Speak about cancer in general, speak about NCDs prevention, and more we speak and better is, because we are more aware, we are ready to take any preventive measure that are available. I'm very pleased to know that stigmatization is very low, and I would like to know if it is the same in the Gambia about HPV and cervical cancer.
Yeah, just joined Dr. Clark to say not much is really known about HPV, even in the Gambia too. And in coming to stigmatization, I would more or less just call it as a self-burden. because one of the signs and symptoms of HPV is like oozing out a very offensive odor. That is at the progress stage of having cervical cancer, very liquid, that is odorous. The lady oozes out, and she might not even be comfortable as an individual to sit among the midst or even family members. And the other thing is psychologically, they are burdened because all the time you're either like, are they gossiping about me? Because wherever I sit, I will have to ooze out some liquid that is very offensive, and you're not yourself at any moment in your life. It's like so painful. And wherein you see two people laughing, you're like, oh, probably they're laughing at me. So psychologically, it's a burden on even the patients themselves, like those infected with the cervical cancer. I was like, I would talk about stigma, but at a very little level. But then I was gonna talk about the burden of HPV on an individual. Because one of the symptoms of HPV is, having oozing out fluid that is very offensive at the cancerous stage of it, at the very chronic stage of the HPV, and of cervical cancer. And that alone is traumatic or traumatizing to the patient herself. Because wherever you may be, you're like not very confident of yourself. If you see two people talking, you're like, oh, they're gossiping me. Is it because of I ooze very offensive smell and so many other things? So psychologically, you as an individual, you're traumatized. And talking of stigmatization of HPV, despite the fact that not much really is known about the disease, but we still can raise awareness. Where it is supposed to happen to an individual, it will be limited or will not even happen at all, by sensitizing, starting from the family members. Start with the family members, because these are the people that are very close to somebody that has cervical cancer, perhaps, and she needed a lot of care from the family. But not until and unless they are aware and understand how we should help our patient. So the family is one group we can target, and also the communities, because stigmatization also most of this is happening among the family members and also communities. So these are people that should really know much about it, and if there had been any member that is being affected, they really can support psychologically, physically, socially, so that the person will also feel the care given. Over.
Absolutely. So again, we underline the importance of different type of health professional, like the family, and how much they can do and should do in supporting, in avoiding stigmatization of cancer in general, and in that case of cervical cancer. Thank you very much for going in depth into this part. We have some time left, and I would like to dig in another aspects of the HPV gender neutral vaccination, which is more related to economical impact. I've heard in both presentations some ideas on how to perform effective advocacy. So Adolphus provided a very in-depth analysis of why gender-neutral vaccination has a huge return on investment. And Bayang, in her presentation, said a very nice sentence about the Minister of Health is advocating for getting money for boys. But we all know that very often it's not the Minister of Health, but it's the Minister of Finance that then decide where money goes. And then afterwards, within the health area, we can decide what goes for care, what goes for prevention, and if in prevention, what is to be prioritized, because finally it's always a way to prioritize. And what speaks most to minister is money and visibility. So I would like to discuss with you first money. And I invite first Adolphus to go a bit more in depth on what is said about the economic return on investment, and also to tell us about any successful stories within his government about HPV or another area in health that can be then applied to HPV gender neutral vaccination, so that we are all equipped as public health professionals of knowledge and ideas on how to speak with our policymakers, our governments, because it's true that we are very well equipped with knowledge in public health, not in every area, but in general, yes, but much less in the economic aspects of public health. And we may need to develop more this part. Adolphus, over to you.
Thank you. Thank you. Okay, so thank you. Again, like I said, let us look at a poor mother, a mother who is struggling and has to feed a family, but that mother is a teacher. That's an instant case, and woke up to the reality that her child has HPV. Her 10 years old or 11 years old girl child has cervical cancer. I mean, that's an instant case. And that mother has to juggle between work and taking the child for regular treatment. What we see happening to that mother or that family is that their purchasing power diminishes substantially because they are not affluent. She's just an ordinary teacher. So whatever earnings that she's getting is being used to attend to the well-being or the health of her daughter. Then put it the other way, that her daughter has received the HPV vaccine and has acquired protection against cervical cancer. So from a health perspective, monies that should have been used to take that girl child for cancer screening and then subsequent treatment could not be used to support the families in different respects, either ensuring that she gets transportation to go to school, or ensuring that additional food or groceries are bought for the family, or something else, or that could be used as savings. So that's the first place, right? From the angle of the health systems, resources will always be scarce within the health sector. And so what is critical is how do we maximize the little resources that we have to achieve greater outcomes, which I would call technical efficiency. Just like having small workforce, greater results, limited resources, greater results. So how can we maximize resources? So take, for instance, if the Minister of Health was thinking on discussing with the Finance Minister for money for setting up a cancer center at Y Health Center for cancer screening, and we are able to demonstrate that the HPV vaccination program is working so well, then that money for setting up cancer screening center across the different health facilities could now be used to support other health system strengthening areas. So what will happen would be the communities, they are sensitized, they are informed about HPV. So all you do will be early detection through the surveillance system, and then you make the appropriate referral. But what you encourage the communities to do is to ensure that all of the targeted beneficiaries get vaccinated, because we know that the HPV vaccine provides protection against HPV 16 and 18 that cause 70% of cervical cancer across the globe. So if we are able to ensure that the communities can take matters into their own hands by ensuring that all targeted beneficiaries get vaccinated, by ensuring that the schools within the community health clubs talk about HPV. The media outlet talk about HPV. Then you will come to the realization that HPV becomes a disease known to everyone. And so the uptake of the vaccine will be very high. Investment by the government can be redirected to support other areas because people know about the disease. So when anything happens, they know exactly what to do. They know the different steps. But if you have the situation where if people they don't know about the disease, so the money you have, that means you'll be thinking that every step will have to do this. So we think from an economic perspective, yes, there are economic dividend if you have people being protected and vaccinated against the disease, because then spending for that disease will reduce and savings can be redirected to support other health system strengthening areas. Like for instance, you could use that to support maternal health. There could be concerns around maternal health. How can you focus on reducing maternal mortality if this is an issue? That savings could be used to strengthen maternal mortality reduction strategies, as opposed to going to invest in buying a machine to do screening for HPV, when in fact you could have contributed substantially to averting cervical cancer just by ensuring people are aware of the vaccine availability, the importance, the benefits, and then why they should have their children being vaccinated. Over.
Absolutely. Thank you very much for giving this very concrete example of how we can and should maximize the resources, even if limited, to get the best technical efficiency. Mbayang, you want to comment on that?
Yes, even though Dr. Clark really have touched on most of the sensitive areas, but when we talk cancers, they are very expensive at the individual level, at community level, and at large at the governmental level. And if money is really to be put into cancers, strengthening other section of the health department alone, not even other sectors, but just by the health department, so many things would lack in other health services. And the only way we can prevent cervical cancer and less expensive is by having our primary targets vaccinated. And vaccination is the answer to HPV across the globe. And with my country context, the Gambia is one of the low-income countries. And even when it comes to the vaccines we are using, have been donated, or we have been supported by Gavi. Gavi is the ones buying all the HPV vaccinations or vaccines we are using currently. And also PATH also doing so very much when it also comes to operational. So we are very grateful to those organizations, the PATH and also Gavi. And like cancer so far here is very expensive and difficult. Even when it comes to screening, it's not decentralized. It's just like some part of the countries that really had the services, and the greater portion of the country really don't have services for male cervical cancer screening. So you can see if you really want to be screened against cervical cancer, you have to pay fares all the way from up country down to the urban centers to have the cervical cancer screening services. So cervical cancer is very expensive, and if we really want to divert all funds there, it can also create other issues among the health sector. But then the primary prevention here is vaccination. So we encourage everyone to get the HPV vaccine so long as you are eligible to be vaccinated.
Thank you very much. And you touch a very important point. Gavi is a key player in many African countries in concerning vaccination. How do you see Gavi role in promoting a gender-neutral HPV vaccination? As you know, some countries in Africa, like Cameroon, Cape Verde, etc., have introduced a gender-neutral vaccination, even being part of this Gavi, let's say, a recipient's country for the vaccine. So how do you see we can strengthen the links with Gavi and have the help of Gavi and other donors, because we may have others in the country and outside the country, to facilitate the implementation of HPV gender-neutral vaccination? Bayang, you want to come first?
Yeah, I would just want to say a little about it. Of course, we're very grateful for Gavi's support and for Gavi to really help in having enough vaccines is the problem, because at some point, probably there is a global shortage of the HPV vaccines. And it is also important for the country to really put up their case, wanting to have a gender neutral vaccination so that both boys and girls that are eligible or that are our beneficiaries can be vaccinated. But unless and until we put in a strong justification for Gavi to provide the resources, because so far so good, not only the HPV vaccines, but they're also providing all the new vaccines for us. Over.
Yes, thank you very much. Adolfo, what is your opinion about that? How we can putting in the case for Gavi and other donors to invest in gender-neutral HPV vaccination?
So, like I said earlier, I mean, it's high time that we begin to pay a very close attention to non-communicable diseases. If you look at the WHO report of 2023 September, I think September 16 thereabout, it's very clear that 74% of global deaths are attributed to NCDs. Hypertension, cancer, diabetes, you just name the difference. So we have empirical evidence or evidences to use as an advocacy tool to attract resources to support HPV vaccination program. I think we should use said data to trigger a call for action with respect to cancer prevention and control, using HPV as the path. I think once that is done at the global level, the regional level, the country level, the county level, district, that sets the stage for sustainability. The second thing is that it's an open secret that globally there will be priorities of resources. Every institution has got its own priorities. We saw a typical example with the issue of inequities around COVID vaccination during the COVID-19 pandemic. Bigger nations had to focus on protecting their people as a top priority before reaching out to other smaller nations. And that's a fact. That's the main part of the law of nature, self-preservation. So countries will have to develop a sustainable plan to ensure uninterrupted investment into the HPV vaccination program and by extension immunization program. And I think one of such opportunities that countries have got has to do with levying of taxes. You have the legislature, for instance, or the parliament, whatever it may be called in your respective countries. How can we advocate with them to establish a trust fund for immunization by law? And you begin to levy taxes on telecommunication, for instance. You say that for every GSM call, you are going to add 1 cent or 10 cents or 5 cents, whatever that law says. You say for every tobacco product, you are going to pull this amount. Alcohol, you're going to do this amount. You talk to concession companies that are making good on their corporate social responsibilities. How can they begin to contribute to the trust fund? Because sustainability is key. We saw COVID, there were lockdown, people could not travel, and that's why in-country capacity is very critical. And COVID made that very clear. When COVID came, there was lockdown, no flight. People then began to use local expertise. So this is just a wake-up call to say, hey, we need to start mobilizing domestic resources to contribute substantially to the fight against HPV. However, this is our medium term, this is our long term. The short term would be to advocate with donors and other international partners to support. But the medium to long term, governments should begin to invest in her HPV vaccination program. Because even with Gavi, you got, once your country is no longer fragile, you move to another stage until you graduate. So Gavi is not even going to procure the vaccine for you throughout. Once your country is no longer considered to be a fragile country, you have to graduate so as to give opportunity to other fragile nations to benefit, or countries to benefit. So I think sustainability is key, and as soon as we can develop a clear, sustainable path around HPV vaccination, the better for us. Over.
Thank you very much. And this call for action for building a trust, a national trust fund for immunization and for HPV gender-neutral vaccination is very, very important with the timeline you have shared with us and very concrete suggestions. And we can even think beyond that, we will need a trust also for NCDs prevention, etc. So to make sure we have sustainable approach to prevent disease rather than to care them with a high cost in terms of life, money, suffering, etc. So very, very important to start mobilizing what we have, not only international, but very important in the nation with clear decision by the government. I've seen there are a couple of comments in the Q&A. The first one is from Dr. Beza, the founder of Servi Health. And I would appreciate, Dr. Beza, if you tell a bit more about this experience. And then you find also eventually the email and phone number of Dr. Jose. He is very keen to go on for collaboration. And before listening from Dr. Beza, I would like to invite our speaker to think about their closing message of this webinar. And what I want to ask them is to prepare like a 1-2-minute speech they will do with their governments or with the key player in their nation to convince them about the need to invest sustainably in gender-neutral HPV vaccination. And this will be the key message, take-home message from our meeting of today. But first, Dr. Beza, the floor is yours.
Hello, hi everyone. My name is Matanda, and yes, I'm the founder of Servi Health. We're a fairly new social enterprise. And our context actually comes from the fact that I was diagnosed with cell abnormalities after my first pap smear. And I have a background in biomedical science, a master's in global health and development from UCL, but I knew fairly little about cervical cancer and the preventability. And speaking with my peers and my colleagues, this was a common thread. I agree with everyone that vaccination and gender-neutral vaccination should be prioritized. Thankfully, in the UK, this started in 2019. But before that, I think we need to think more about the educational level. Communities already exist within which information is being shared. And I think it's about finding accessible and appropriate ways to reach existing communities to share this information. So we have this conference today, which is fantastic. But how can we translate conversations like this to our target populations, who are teenagers, who are young people, who are in tertiary education, and some are not, some are in informal employment. So what we do is try and capitalize on existing technologies such as WhatsApp, which is growing on the continent. We also capitalize on Instagram and try to be a voice of medical evidence-based information, but in a way that's fun and approachable. And it's fantastic to hear that there isn't so much of a stigma in Gambia, but we can also capitalize on that and shape the narrative. So, you know, for example, having HPV doesn't automatically mean that you're going to have cervical cancer or other types of cancers, and that most people will come across or be infected with the virus. And if we can shape the narrative as medical professionals, then I think then people will be more receptive to having the vaccinations. And even further than that, they'll be empowered to make decisions about other aspects of their medical lives. So I think we need to perhaps also focus on how are we translating this important existing information into a way that can be received by a 13-year-old girl. So yes, thank you.
Thank you very much. I can't agree more. We need to inform the generation that is our target with a message that speaks to them. And most probably, if we can have very famous singer
Yes.
be the leader of this message, even think about that would be far more effective than all the public health professionals together, unfortunately. Anyway, we should not stop to transmit the message from all the possible point, public health professional, teachers, mothers, and influencers. We have so many good influencers for clothes, for lifestyle. We need to have them on board for more important things. And also to be able to give good information and change the narrative, as you say, is a vaccine that prevents cancer, full stop. And very important, and what is often not said, is that the reservoir of the virus are the men, while those that pay most of consequences very often are girls. But now also the trend are changing because we have other type of cancer or pharyngeal that are both of boys and girls and women and men. So we need just to protect each and every of us through an appropriate vaccine, that for once we have a vaccine that prevents cancer. And this is the only information that is very important and that our children should consider, and we need really to find a way that is appealing to communicate to them. So thanks for the work you are doing, and thanks to the work that many of us are doing in this direction. With this last intervention from the audience, I really would like to bring this very interesting 2 hours training session to the end with the final take-home message from our speakers. As I ask you, I want you to make a very brief pitch or whatever you think is more appropriate to have a very brief message of what is very important to say to your minister, to your policymakers, to convince them that gender-neutral vaccination is needed. Ladies first. Bayanga, your final message.
Thank you, Maria. And the question you asked, how do I even say? Okay, to gender neutral HPV, obviously, it's very important. And having to have a very free population of the HPV, you have to have the gender neutral, like protecting everyone across equitably, both boys and girls. And knowing too well that the vaccine is effective on those that are yet to be sexually active. So I would, as a country, it is important for policymakers, the Ministry of Health, international stakeholders, and also other private stakeholders within the country, because we had the public-private partnership here, to come forward and put resources together. Because as a country, you also have to look at the long-term benefits, not only the short-term. Yeah, we are having supporters out there internationally, but really continue. How about if there is donor fatigue? But then as a country, what should you do? Whether or not you've been supported, you are supposed to move as a country. So I applaud to all of these people the families, communities, individuals, everybody to come out and support gender neutral vaccinations, and also put ahead monies or budgets that will cater for the gender neutral vaccination, and as well as create more awareness to the general public to be able to know the burden of HPV in the country, more so trying to lead to one of the most deadly cancers among women, which is the cervical cancer. And thank you for having me. I am very grateful. This is one avenue that will really help me to really, talk HPV. So thanks.
Thank you for being with us. It has been really enlightening listening to your experience and the one of your country. Adolphus, what is your closing message?
Okay, sorry. Again, let me start by thanking everyone who took up their busy schedule to join this webinar. I mean, this shows your commitment to a world free of vaccine preventable diseases. This is something that I deeply appreciate as a person, as a panelist sharing my perspective. I'd also like to say a big thank you to the organizers for reaching out to me. I didn't think that I will have come true given multiple tasks, but I think this is a demonstration of putting service above self, trying to share your perspective. So this is something that I took and had to make time. That being said, I'd like to begin with the question, if it is not us, then who? If it is not now, then when? And so that is the kind of mentality I take back to the ministers, be a minister of health, a minister of finance, a minister of education. The data is there. Just using Liberia data as a case study, the leading cause of cancer mortality in Liberia is cervical cancer. Our sisters are dying, our daughters are dying, our nieces are dying, our mothers are dying, our aunts are dying. If it is not us to take that action, then who will take it? If it is not now, then when? So I think it's clear that there has to be a call to action, irrespective of where we sit, to ensure that HPV is given the highest priority, not just in the executive branch of government, but also at the level of the legislature. We in Liberia has been able to establish what we refer to as the Parliamentary Forum for Immunization. So I think it's an opportunity for us in one of our sittings to again sit with them and bring out the issue of HPV in a greater magnitude. I hope during our meeting we have the Minister of Health, the Minister of Education, and the Minister of Finance committing themselves to fighting this and making sure that resources and other support are made available to support the HPV vaccination program. On that note, I want to say a big thank you to everyone and look forward to always sharing my perspective as and when needed. Thank you.
Thank you very much. And with this word, we have reached the end of today's webinar. And on behalf of the World Federation of Public Health Association, I would like to thank first our two incredible speakers, and if possible, I invite also Mayanga to open her video so we can give to both Adolphus and Mayanga a virtual round of applause. I want to thank you all for being with us for such a long time in your very busy day. I want to thank MSD for providing an unrestricted grant to support our activity, as well as the University of Geneva.